I'm Dr. Chuck Ng. I'm a developmental behavioral pediatrician. I specialize in treating children with autism and ADHD. Developmental Behavioral Pediatrics is a board-certified pediatric subspecialty, just like pediatric neurology. And it mainly focuses on the management of neurodevelopmental disorders such as autism, ADHD, anxiety, prematurity. I was trained in New York. I worked at a children's hospital in Queens, so I had a very broad experience and got to see a lot of diverse patients in high volume. So it kind of developed a really good background and foundation. And then I worked at a large health organization out in California, where I helped sharpen my skills, and I was actually elevated to the role of section lead for one of the largest counties in the area. And I helped maintain the standard of care and developing the best practices for managing patients with ADHD as well as autism. So originally I was an operations manager at a facility, and the facility was sometimes dangerous. And someone got hurt that day, and as the junior manager, I was on site and I tried to help, but I didn't know anything about medicine. And all the managers took a vote and said someone should get training. So I volunteered and I enrolled in emergency medical technician training, and that's when I got hooked on medicine, and I became so interested. I gave up that life and went into pursue medical school, and I got in. As for pediatrics, when I had my first child, I was thinking of going into emergency medicine because that was all emergency. But then my son was born, and my wife spiked a fever, so my wife had to be in recovery, and I was sitting in the NICU with my newborn son, and I kind of was scared and didn't know what was happening. And I kind of pivoted my whole career and how to follow my son. I said, yes, I'm going to pediatrics because I need to know a little bit more about this little person in my arms. And that was kind of how I chose my path into pediatrics. And then fast forward a couple of years, my pediatrician noticed that my son wasn't really talking too much, and he was evaluated by early intervention. And that's when I received the diagnosis that he may be on the spectrum. And at that point, I was in a very big children's hospital training, but everywhere I asked, not many people knew anything about what was happening, what could give me advice. So I went and found my future mentor at one of the subspecialty clinics in my children's hospital. And I learned all about, developmental delay and what to do. And I realized there was a great need. And so, me being the person I am, I wanted to make sure that I knew what to do for my own son. So I kind of went into the field. And I have to say, I learned more being his father than I actually learned from being in the field. Like actually from fellowship. Because living it is very different than learning about it. I try to gauge where they are in the progression, because there's many different stages. If you're new to the diagnosis that something might be different about your child, it can be very shocking. And you don't even know what you don't even know. Like, you don't know what questions to ask. And so I kind of prioritize, like, what are you ready for? And I kind of think holistically. So I do think more than just the problem that you're facing right now. I think about the many problems that you might come across later in life. So I kind of think of a broad overview. So I do have like plans for like the immediate interim, and then the middle, and then even the future, like college. So I like to think of it in that perspective. And so it's not uncommon for me to bring up things for patients and families that they've never heard of. No one's ever told them about. And that's because if you don't live the field, you don't breathe it, you probably don't know about it. And so a general pediatrician only has 15 minutes, won't probably know much about the things that I would talk about. And they don't probably have experience dealing with the things that we deal with on a daily basis. When you enter my care, I really try to make sure I deal with every aspect of the patient's life, from activities of daily living, school, how will they progress to like work, things like that. Having been through it, it's very different. If you see pediatricians that never had a child and pediatricians that have a child, it's completely different. They just know from experience what to say and what to do. And so having been told that something might be different about your child, I know I've been in that chair, and I kind of understand like what I wish someone had told me in the beginning and how to think about it. And so that's how I kind of approach that. Because a lot of times parents, the first thing parents do when they hear something like this is they often blame themselves. And I've been there too. Every parent does, but I kind of assure them that, a lot of the problems that we face, they aren't due to some mistake that a parent made. If there was, then we would, CDC, AP, everybody would make recommendations. Don't do that, right? But you never see those recommendations because there isn't really a way to avoid some of these problems that we face, like developmental delay or autism or ADHD. You can't prevent it. So I kind of approach it from that angle to make sure parents understand it's not something you did wrong, but it's something that you can help along and definitely improve. So I definitely feel the field is getting more exciting as science progresses. At a large health organization, I wouldn't be allowed to kind of innovate or try new things. But now that I'm in private practice, it definitely allows me that freedom. And so one of the things that we've tried now is new testing for like the folate receptor alpha antibody, which, it's new technology, it's a new test, but it has a lot of upside and it's really safe. The intervention is very safe. It's just folate. So I feel like being at the forefront and just making sure you're up to date with all the new innovations or discoveries allows me to kind of make sure that we provide the best care possible to a patient, as opposed to being in a big health organization, which may be 10 years behind cutting edge technology just because it takes that long to write a ship that large, right? I definitely think we're getting a better understanding of the holistic aspect of treating a patient. When you look at medicine historically, it's really like medication-based or surgical-based interventions. And we really didn't pay a lot of attention to diet, which has a huge impact, a lifestyle, which has a huge impact, right? Like you're just taking out of a book of medicine, like diabetes, what's the treatment for diabetes? Most physicians will just prescribe like metformin, but they should have really taken the time to be preventive by addressing diet and exercise, right? And so I feel like this is probably the thing that is going to be the one missing piece that hasn't been really addressed often enough or as much as we should, and to make sure people have not just physical health, mental health, right? And so these are the things I think psychiatry will be moving toward in the future. Words of wisdom. I'd have to think about that one. I guess the one thing, going back to parents, is since I'm in pediatrics, a lot of parents get lost in the past. They try to think about what could have caused this? Why did this happen? What did I do right or wrong? What didn't I do? And I often find that this is not helpful because no one can change the past. You can't go back in time and say, okay, I'm going to correct it. I'm not going to do this next time. It's a lot of wasted energy, and it's not going to make you feel any better, and you'll lose a lot of sleep. So my words of wisdom is to really focus in the present and the near future, not too far future. A lot of parents get lost in the far future. Like some of the questions I ask on a 2-year-old child, they're like, is he going to get married? Like, how would I know? It's like 18 years in the future minimum, right? If I could see that far ahead, I would play the stock market. So I often tell parents, focus on the present, not the past, not the far future, just in the near future. Maybe like 6 months, 1 year, 5 years, but not like college, or if your child's like 1, like, there's no point in thinking that far ahead. And that's how they should really keep their mind frame. And when they catch themselves going off that plan, to realize, oh, this is not helpful. Just let's go back and focus. What should I be doing now? Next 3 months, 6 months, 1 year, and so on. What should patients hope for? I would say not hope, but just realize that every child's trajectory is different, and there's no, template that everyone's going to follow. And so whatever you read about another person online or like statistics, just realize that might not apply to you. And that person's journey you read about is not maybe your journey. And so to keep an open mind, the one thing I do like about a diagnosis of autism, like people like get scared about it, but I'd say it's not predetermined. So, like with cancer, they can give you these like statistics, like, 5-year survival rates. But with autism, it's really wide open, especially how early do you get interventions and what type of interventions do you pursue. So you have a lot of ability to affect that outcome. And so that's one of the things I think is most important to understand. And that gives me a lot of hope because it tells me every day, and I've seen it, is that nothing's written in stone, that we can definitely change a lot as people and as patients. And so don't give up hope, and be hopeful, and keep an open mind, because you can never guess what will happen. Just from my own personal experience, if you had told me when I found out that my son was delayed, that he'd be a straight A student currently in high school, like, I probably wouldn't have been able to believe you at that time, because I was like, worrying all the time. But that is what happened. He's a straight A student in high school. So really, you can't really predict what will happen, but just keep an open mind, just be hopeful. And you might be surprised, pleasantly surprised.